Hi, I'm Neha Pagadipati, and I am a cardiologist at the Duke Clinical Research Institute.
Hi, my name is Monica Reed, and I am a clinical research associate with the DCRI.
Monica, thank you so much for joining us to talk about the Coordinate trial and about implementation science. Implementation science, I think, is an incredibly important and growing field because we're realizing that even though we have all of these medications that help us make patients live healthier and longer, a lot of these medications aren't being used when they should be. And we really need kind of rigorous scientific methods to help us understand how we can do what we know we should be doing in clinical practice. So that's how I think about implementation science. And we know that, for example, in patients with diabetes and cardiovascular disease, which is who we're focusing on in the Coordinate trial, a lot of those patients just aren't receiving the evidence-based therapies that they should be. For example, we know that across the world, less than a third of patients are getting all of their risk factors managed so that they can avoid future heart disease. And that's just not acceptable. We need to be doing better, and implementation science can help us do that. Monica, you're an incredibly critical component of what we're doing in the Coordinate trial. So would you tell us a little bit about what we're doing to help patients receive the evidence-based therapy that we know they should be getting through the Coordinate trial?
Neha, I think some of the most critical components of the Coordinate intervention are the intensive education that starts with the faculty. We have faculty here at the DCRI that we're working with, but we've also recruited external faculty from academic centers across the country, and that includes a complete trio of a team that goes to the site. We include a cardiologist, an endocrinologist, and a quality improvement specialist that go on site to each one of our intervention teams and sits down with them and talks about care pathways, what's working, what isn't working. We talk about the guidelines, and we help them have a clear understanding of some of the different ways that they can approach this unique patient population. We know that each site has different challenges that they face. Each one of our sites in the Coordinate study are unique. We have some smaller community-based sites, and we have some that are based out of larger academic centers. So the resources that are available at an academic center may not be available at some of the smaller community-based clinics. When our team goes in, we help them identify some of those challenges and opportunities, and then we help them develop strategies to address each one of those. We have created a toolbox of items that they can use and pathway examples that they can use at their clinics. The learning module systems are based on all of the guidelines, and we have some of our faculty here, you included, who have spent a great deal of time creating those. After the site visit, one of the important things that happen is our faculty creates a site visit summary. It takes the pre-assessment that the site does, what we learned at the site visit, and we create a comprehensive analysis for them that they can take and use with their team to create an action plan and develop a strategy that works for them at their clinic. After the site visit and they've reviewed their summary, then we continue to work with them one-on-one. We have monthly calls with their team, and we collaborate with other sites. So we invite other sites to WebEx type education, and we share best practices. We share case studies with each other. We say, hey, this site in Florida is really struggling with this one key concept, or working with their physicians to start prescribing some of these medications. What are you doing at your site? And we allow them to work together so that they can develop relationships between the intervention sites. And I think the relationship between our faculty and the sites is important, but what's even more important is the relationships that sites have with other intervention sites, because that's where it's real world. That's when it gets really exciting to see people sharing and partnering ideas and sharing pathways that work.
Right. And I think from the site visits that we've gone to so far, some of the most exciting work has been when sites have been brainstorming with us and sharing real examples of patients where they've struggled to get them on the evidence-based therapies, and we brainstorm about potential solutions. I think that's where some of the greatest advances have come from. I completely agree.
Yeah, and I think we learn something every time we go to a new site.
Right. And I think that really highlights the idea that implementation really is a team sport. It can't be done just by clinicians. I don't think it can be done just by operational folks. And it really needs to be done in partnership with the sites. And I think that is one of the amazing things that has come through with the Coordinate trial, and especially with the work that you've done and you've led with the study, that this really is a team-based approach to bettering patient care. And there's a great partnership within the DCRI, not only between the clinical faculty, but also between all of the quality improvement experts like yourself and all the operational faculty who know how to work with the sites to achieve the goals that we're all trying to achieve. So I think that is a really unique and important part of the Coordinate trial.
Yeah, the bottom line is it's a collaborative partnership, and none of us can do this by ourselves. We learn from what the evidence shows us, but implementing it at the site level and giving them something that's sustainable over time is really
a whole different world.
Oh, it is, definitely. And I think the collaborative partnership between our operations team here at the DCRI and with our faculty, both internally and externally and at the site level, is key so that we can take these concepts and share them and continue to make improvements in patient outcomes as we move forward.
Right. Monica, thank you so much for joining me in this conversation. It was really fun to talk to you about the work that we're doing, and I look forward to all the work that we'll continue to do on this trial and in others.